Welcome to One Training, where we provide health and fitness content to help you achieve your goals. Choose the fitness course professional athletes trust. Click the link in the comments to learn more.
Hi everyone, it's Chris from One Training. Today's video, we're going to look at the health-related components of fitness, and we're going to look at the different types of client fitness assessment records. Okay, so the health-related components we're going to cover are going to be cardiovascular endurance, muscular strength, muscular endurance, and flexibility. Okay. And then again, we're going to discuss how different formats or different types of information in the fitness assessment records will help the trainer and the client meet their fitness goals. Okay. So to start with, we tend to focus on the health-related components of fitness because they are obviously they have a greater impact on their overall health, and not just improvements in strength or cardiovascular endurance, etc. Okay, and they're also easier, and a lot more. There's a greater benefit to having and improve these things. Okay, so if we have a quick look at each one of them specifically, so cardiovascular endurance refers to the heart, lungs, blood vessels, or the respiratory circulatory system's ability to deliver oxygen and nutrients to the muscles during prolonged activities. Okay, it can be measured doing things like the beat test, and we're really assessing the client's ability to maintain aerobic exercise over time. So again, think about activities like running, cycling, even swimming. Okay, and individuals with good cardiovascular endurance can perform moderate, even high intensity exercise for longer periods of time without fatiguing. Okay? Muscular strength is the second one. So this is what I like to call the how heavy can you lift, basically. Okay, we're just focusing on that aspect. So it's the maximum force a muscle or muscle group can generate. And this can be measured with things, exercises such as the bench press or deadlift and squat quite commonly. And again, we're just looking at how much weight can they lift. So again, think about anything that requires lifting, pushing, pulling, and this could be in and outside of the gym. Okay. And again, it's been shown that if we have, better overall strength, okay, again, it's not going to just improve our physical health, but also prevent injury long term. The third one we'll look at is muscular endurance. Now, this is almost the polar opposite to muscular strength, in the sense that we're looking at how long or how many times can a muscle or muscle group exert force or perform an exercise or an action over a period of time. So think about things like push-up and planks. So any type of body weight exercise is a great way to kind of measure these. And again, we can look at how many repetitions or how long they could hold a certain position, or how long they could do push-ups for, things like that. So again, if we're looking at this aspect, we're looking at activities that require repetitive movements. This could be cycling or rowing type events. It could be body weight exercises or movements. And again, ideally, where we're trying to reduce the point of fatigue during certain exercises, okay, or activities. The last one, so when we talk about range of motion around a joint, okay, this is the definition of flexibility. So we look at muscles, tendons, ligaments that surround a joint, and how they're impacting on the range of motion there, for better or worse, okay? So again, flexibility means that we can move freely and do any type of activities we like without any risk of muscle strains or joint injuries. So if we do simple tests like sit and reach, or even just doing simple, different types of stretches for certain areas, again, we can measure the distance they can reach, or if one side or one type of stretch is easier than the other. Okay. But the main, I guess, the take-home point here is that if we look at these overall components of fitness, and we can improve strength and endurance and cardiovascular health and flexibility, again, we can promote and improve long-term health. Okay, and I guess, create programs for our clients that are going to not just address their specific goals, but also improve their health and well-being. Okay. So the next part we'll look at is, obviously if we're going to be testing different types of goals or components, okay, we're likely to come across different formats or different types of client fitness assessment records. So a fitness assessment record is something that we use to track progress. And this can identify any areas of improvement or just giving us a baseline to start from and compare any assessments we do down the track. So they may include, personal data like the client's name, age, contact information, and any relevant medical history. It's also going to, assist us when we're doing our pre-screening and we identify any pre-existing health conditions. Okay, this is going to help us, understand what we may or may not be able to do in terms of an exercise program. Okay. Obviously, we want to always use the assessment date because, again, this will allow us to see how much time has passed and how much time it's taken to progress, or if there's been any at all. Okay. It'll also help us determine how often we might test things. Okay. So if we aren't seeing an improvement in a certain amount of time, but then we maybe extend that period between testing, we may start to see some then. Okay. So it will kind of help us with some of the individual ins and outs. Again, obviously, the specific tests we perform during these evaluations, we're going to document. Okay, so we want to be able to compare the results. And again, the only reason we're doing this is to have some sort of measurement for progress or to identify if there is any progress over time. So if we're going to be doing things like measuring the person's body weight, doing body fat percentage or skin fold testing, measuring girth, again, we may include these because they may be specific to the person's goals. Or again, if we look at health-related components, things like BMI can show us any risks associated with their current height and weight. Okay. And again, once we have collated all the information and created this fitness profile, okay, we can then, as trainers, start to include recommendations and set specific goals, based on the assessment results. Okay, so this could be suggestions for exercise, dietary advice, and any lifestyle changes. Okay, so to kind of frame this up, it's important to remember that the information included in these records is going to vary depending on the trainer and also what you can do in the fitness facility, the gym. Okay, but it's important to make sure that we capture and record all the necessary information for their program and to ensure that the client achieves their goals from then on. Okay, but that's it for today.